with severe heart failure. So, cabbage. We're gonna come back to cabbage in a minute. We're gonna talk first about plasties. So angioplasties, and then we're gonna do cabbage. So I actually have a video that I want you to watch on the angio, or on the, oh, I put it somewhere.
Hi, I'm Lauren Hansen, RN. Welcome to the Franciscan Alliance STEMI training video. The purpose of this video is to introduce our code STEMI process to our local EMS, RNs, paramedics, and ED techs. As you're viewing the video, you will see a scenario followed by an educational key point. The first key point will describe typical and atypical signs and symptoms of the ACS patient, risk factors, use of the TIMI scale, and early heart attack care. The second educational point will focus on EMS arrival to a STEMI patient and transfer to the hospital. The third educational point will guide you with what to do with the patient on arrival and what meds the RNs need to give. The fourth educational point will be an overall review. I hope you enjoyed the video. And remember, heart attacks have beginnings.
Yeah,
Good.
I just woke up this morning, my chest felt kind of tight, and I maybe I just pushed it too hard yesterday or something. Try to stretch it out and see if that makes it feel better.
Keep telling him he needs to go to the doctor, but he doesn't want to.
I need a doctor, it's for old people. I'm alright. Thanks.
Thanks.
Because you have to do it. They're bad. Yes. That's what was wrong. That's on her. She's an idiot. No, that's on the teacher. That's on her. She already told her that. I was talking to her about it. So now I have to. That's not fair, am I right? No, because essentially she's asking you to tell her that she needs to have money kicked out the program. I know.
Jim, what's
That's
going
not
on?
right.
Are you
That's
okay?
not a student's job. They did it last semester.
It was a lot worse
She had
this
to redo
morning.
home care plan by herself.
Really don't look so good.
Just we're on her last semester and she's writing good. And then she goes, I said, did you not get weight on this like this well-nourished lady? She goes, oh, they didn't have one. I said, they do. They at least do it on admission. And you know that. Yeah, there's no reason.
Hi, I'm Dr. Eric Cook, Chest Pain Center EMS Director at Franciscan Healthcare Centers. I'm here to provide you with educational key points after each scene in this video. In this first scene, Jim is having signs and symptoms of acute coronary syndrome. As healthcare providers, it is important to recognize and then act when these symptoms present themselves. EHAC is an important educational initiative in understanding that heart attacks have beginnings, and signs and symptoms of heart attacks can present days to even weeks before an actual heart attack occurs. These symptoms are categorized as typical or atypical. Typical signs, or the big five, include chest pain, shortness of breath, palpitations, dizziness or lightheadedness, and diaphoresis. Atypical signs and symptoms can be vague and seem to occur more commonly in women or patients with comorbidities such as diabetes. Weakness, fatigue, nausea, indigestion, pain in atypical locations such as the jaw, teeth, or back, or in a sense of impending doom, i.e. I just don't feel right, are among these symptoms. Risk factor recognition and assessment is equally important in this early stage. Age, family history, gender, smoking, cholesterol, obesity, diabetes, hypertension are among these risk factors. We utilize these factors into a risk assessment called a TIMI score. The score is used to categorize the risk of death, ischemic events, and the need for emergent revascularization in the immediate future with patients experiencing unstable angina or non-ST elevation myocardial infarction. The TIMI score is calculated by assigning points to categories. These categories include age greater than 65, aspirin use in the last 7 days, at least 2 anginal episodes within the last 24 hours, ST changes of at least 0.5 milliliters on admission EKG, elevated serum biomarkers, known coronary artery disease, i.e. coronary stenosis of greater than 50%, and at least 3 of 5 risk factors for coronary artery disease. These include hypertension, high cholesterol, cigarette smoking, diabetes, and a first-degree family member who has coronary artery disease under the age of 55.
It's okay, Jim. Paramedics are here.
Hi, sir. My name's Rob, this is Jeff. We're paramedics from the fire department. We're here to help you. What seems to be the problem today?
I woke up, my chest felt kind of tight, but came here and started working out. Now it's real heavy and I'm having a hard time breathing.
Is it in the center of your chest or does it radiate anywhere?
It's right here, but it feels like it's going over to my left arm here.
Okay. On a scale of 1 to 10, what's your pain scale?
I guess like a 9.
Okay. All right, I'll tell you what, sir. We're going to go ahead and put you on some oxygen. After you've been on the oxygen, I want you to let me know if that pain has gone away or it's improved at all. There you go. Do you have any medical problems that we should know about?
High blood pressure and high cholesterol.
Okay, are you allergic to any medicines? Alright, so we're just gonna put these stickers on your chest. Push it up here.
Does that hurt?
No, it's not gonna hurt at all. How old are you?
28.
48? What's your mileage, Jeff?
Blood pressure is 1.2 over 78, pulse 72, respiration 20, clinically clear.
How's your pain after the oxygen, sir? Still any better? Alright, we're gonna go ahead and start IV. We're gonna give you some nitroglycerin under your tongue. We're gonna give you some aspirin. You mentioned that you weren't allergic to any medicines, correct? Okay, we're also gonna give you something for pain.
We're going to transport this 12 lead to the hospital so the doctor can look at it before you get there. Then we're going to transport you to an accredited chest pain center.
The educational key points in the second scene of this video are pre-hospital EMS care. Pre-hospital care has become of paramount importance. Our EMS first responders are on the front line with first contact of patients experiencing chest pain or acute coronary syndrome. They need to do a quick assessment of history, risk factors, and pain level. EMS personnel then need to obtain vital signs, apply a monitor, O2, establish IV, and then determine the need for interventions. Most patients having chest pain or symptoms consistent with acute coronary syndrome need aspirin, nitroglycerin sublingual or spray, and most importantly, a 12-lead EKG needs to be performed and transmitted to the receiving facility. Report needs to then be given to that receiving facility. Minutes matter with patients experiencing acute coronary syndrome. It is with this efficient and timely action that patient outcomes improve.
Francisco Lyons, go ahead.
I have a paramedic 7 from your location, 32-year-old outpatient, with chest pain, left arm. And so this morning I went away while working out, stayed the pain came back. And initially with the 8 out of 10 scale, nitro is now 4 on a 10 scale. Vital signs 122 over 80, pulse is 72, respiration is 18, lungs are clear. Skin was initially pale, diaphoretic. At this time, color is returning and skin is drying up. No history, no medication, no allergies. You have an ETA facility in about 5 minutes.
That's exactly him. I followed her some miles and contact us needed. 595 St. Margaret's out. Dr. McGovern, they just faxed us EKG over on chest pain.
This is a STEMI, activate cold STEMI, heavy and a chloric page on call, interventional cardiologist staff.
52 male, complaining of subdermal chest pain, radiating to left shoulder. After this morning, he went away. While working out, he came back a lot worse. You give him 4 baby aspirin, 1 nitro, pain went from a 6 out of 10 down to 1 out of 10. We already transmitted the 12 lead.
Mammy, can I get a name?
First name's Jim, wife is behind us somewhere, she has more information.
Hi, I'm Dr. McGovern, the ER physician. The EKG that the paramedics did in the field is showing that you're having a heart attack. I've already spoken to the on-call cardiologist, and the cath lab is on their way. You're going to need a procedure in angiogram. It's called percutaneous coronary intervention. We're going to put some dye in and look at the vessels around your heart. Nurse, can you activate the STEMI EVOS? We want to EKG. Yes, activate the EKG.
You're gonna feel a pinch here, sir. My blood will go out at the same time.
Oxygen at 2 liters.
As your chest take, listen to your
It's a little better.
Melts it in my mouth or something. What they said it was.
What's his heart rate right now? 110.
Let's get on blood pressure is 140. 50 of blood pressure, 600 of Plavix. Get them on a nitro drip.
Oxygen 96%.
I'll get the medicine.
Respiration's 33.
And paramedics give aspirin en route, I understand, is that correct?
Correct.
Turn on the IV, it's the right forearm.
Can you do
28.
kind of really still for me, hon, as still as you can for just a minute? Gee, what kind of medical problems do you have?
I have high blood pressure and high cholesterol.
Okay, do you take medications for those?
I do. Cipro and
Simvastatin? Okay. Who's your regular doctor?
family doctor. I just see him once a year for follow-ups and physicals.
Jim, we have to shave your groin.
There's more miles on you, sir. Okay, all right.
Yeah, start on
Still
0.9
feeling
or
okay?
100
Groin and shave.
an hour.
You okay? Yeah?
Do you have any trouble breathing with this, Jim?
Oh, it's much better than it was.
Let me just take a listen on your lungs. Take some nice breaths for me.
Running at 100 cc's an hour.
Couple more breaths for me, Jim.